Hello all, this is Dr. Dheeraj Masapu and welcome to my channel. For people who don't know me, I'm a consultant neuroanesthesiologist. So I give anesthesia for brain and spine surgeries. So in this channel what I do is I react to medical videos and medical jokes and I give something called as a reality score in the end of the video. So I will try to tell you how real the video is to the real medical profession. Today I'm going to react to a video which is done by my favorite comedian and ophthalmologist Dr. Glaucomflecken, and this video is about an anesthesiologist going for a therapy. I think in his sense is a maybe psychologist or psychiatrist's therapy. So when an anesthetist goes for such kind of therapy, what happens there? So let us react to this.
Perhaps you'd like to crush candies another time. Sorry. Now, how are things going with surgery? Fine. Really? Because I see here that there was an incident in the OR yesterday. Anesthesia. For the last time, do not bring surgical drapes into this office. Now, would you like to tell me what happened? Nah, I'm good. Well, according to the circulating nurse, where did
Glaucomflecken projects anesthesiologists playing games most of the time and taking coffee breaks most of the time. Partially agree with him, but I would try to explain it in a very simpler way. So anesthesia is more like hours of boredom and moments of horror. So what happens is, in the anesthesiologist's job is like riding a vehicle in highway. So most of the time it will go smooth, but if something goes wrong, or maybe seconds or minutes of tension involved, in the rest of the time it will go very smooth. During that time, maybe I don't know, I don't do, but maybe some people might play some games or take coffee breaks during that time. But this is an over exaggerated view of, because to generate comedy is doing that, I know, but still this is not totally true, but I totally don't deny that also.
did you get coffee? Oh, I don't know. It's one of the perks of anesthesia. Somehow we just end up with coffee. Well, according to the circulating nurse, you wrote, the general surgeon is a Malampati 4 on the whiteboard. Yeah, so? It is inappropriate to make fun of people's difficult airways. Well, he started it. And then last week, at the end of a 10-hour case, you asked the general surgeon how...
People say that number of coffee breaks that anesthesiologists take are more than surgeons. That is true. Surgeon, once he starts the surgery, cannot move out of the surgery till he finishes that, because he will be wearing a sterile gown and the instruments are sterile and everything is sterile. But for anesthesiologists, as I explained before in the beginning of the video, there are periods where the case goes very smooth and nothing happens during that period. There are moments of terror. The moments where it is going smooth, we give handover to another anesthesiologist who is also a qualified anesthesiologist. We explain the patient's condition, we give handover to him, and he will be staying with the patient, and we take a small coffee break and we come back. So that is done only when the patient is totally in a safe zone and the patient and the case is going on smooth. If the patient is having a problem, none of the anesthesiologists will leave the patient and go for a break.
How his work-life balance was going. I was just trying to make small talk. Anesthesia, you know surgeons don't have work-life balance. That's not my problem. We need to work on your conflict resolution skills. Oh, come on. No, we don't. Let's work through some scenarios. I'll be the surgeon. Anesthesia, the patient's moving. Can you do your job, please?
So this is a very common complaint that surgeons do. Patient is moving during the surgery, patient is moving during the surgery. In this, in a very simpler way, what happens is anesthesiologists give a drug called muscle relaxant during the surgery to keep the patient immobile, movement free during the surgery, so that the surgeon can perform the surgery without any movement. But this muscle relaxant will be eliminated from the body based on the metabolism of the patient. So this metabolism will vary among the patients. We will have a rough calculation, but sometimes it will miss. So those are the times where rarely patient will move during the surgery and surgeon will get affected during the procedure. But if you are a patient watching this video, don't worry, you will not remember anything, because muscle relaxant is not the primary anesthetic. The primary anesthetics are different, which keep you asleep. So you will be asleep, you will not remember anything, but a slight movement will come which you will not know. A surgeon will observe that. So even that happens very rarely, but even this is an over exaggerated version just to generate some comedy. Not so good among the surgeons. It is pretty well balanced among the anesthesiologists, but that doesn't mean that we work less. We work for a pretty 9 to 10 hours in a day, but compared to surgeons where they work for 12 to 14 hours in a day, even during the residency time and even after becoming consultant as well. The reason I'll tell you why the difference comes, because the planning and the workup which is required to do surgery is significantly more than the planning and workup which is required for anesthesia. That is the reason. So they need to finish the cases of today, and then they'll start working up the patient for the next day, and they end up staying 3 to 4 hours extra than the anesthesiologist.
Let's try a different approach.
Hey, dude, how's it going?
What? Excuse me, we're in the middle of a session.
Hey, what's up? You want to take a break? Oh.
So that is the thing. So finally, if you are a medico and want to take up anesthesia, you have a good work-life balance, good career prospects are there. In the next 10 to 15 years, anesthesia is a very upcoming branch. That much I can tell you. And coming to the pay scales and everything, I'll do a separate video. So let us not keep it in this reaction video. Let's come to the reality score of this video. So how real is this video compared to the reality of medical profession? I can say that it is 6 out of 10. Okay. Reason being, I am telling you, it's over exaggerated. The kind of games that anesthesiologists play, breaks that has been projected in the video that anesthesiologists are taking are not real like this, and the movement also doesn't happen in every case and happens once in a while, rarely. So considering all these things, I give a reality score of 6 for this particular video. But Glaucomflecken's videos are brilliant, and I laugh a lot after looking at this video. And thank you for watching the video till the end. If you like the video, subscribe to the channel and click on the bell button. Okay. Dr. Dheeraj Masapu logging off. Roger that.